My name is Dr. Kyle, and I am a doctor of physical therapy. I am a board certified orthopedic clinical specialist, which means that I am one of the top 6% in the country who has been certified by the American Physical Therapy Association. I have an MBA in healthcare management and credentialed by the president and the athletic trainer of the Boston Red Sox and Chicago White Sox. Today's episode will be about congestive heart failure or heart failure, but specifically congestive heart failure. In America, there's 6.7 million adults over 20 have heart failure. There's 960,000 new cases per year, and it's expected to approach 8.7 million by 2030. And this may reach 11.4 million by 2050. 1 in 4 adults is at risk over their lifetime. 1 in 4 adults is at risk over their lifetime, and this is the leading cause of hospitalizations among Medicare seniors, which means that 450,000 death certificates in 2022. That's a lot. That's the leading cause of hospitalizations among Medicare seniors, which is why this topic is super important to me, and this is why this is personal to me as well, because my grandmother had congestive heart failure, and I'm very familiar with this condition. So congestive heart failure simply means that your heart is not pumping as well as it should be. Your heart's main function is to pump blood throughout your body. If the left side of your heart is not pumping well, fluid backs up to your lungs, which causes shortness of breath. If the right side of your heart is not pumping well, then it can back up to your legs. That's exactly why you see people who have congestive heart failure, they have swollen legs. Pay attention to legs of these patients because they are very swollen. I'm going to focus on exercise because I'm a doctor of physical therapy, because there's so many things to be discussed. I'm not going to go into the biology and the pathophysiology of this or how it happens. But exercise does help improve your heart because your heart is a muscle. And if you don't use it, you lose it. Meaning that if you sit all day, your heart becomes weaker. And the last thing you want to do is just sit there all day. So I really recommend for those people who are caregivers who have their grandmothers or mothers or grandparents or any of their loved ones who have heart failure, just get them to move. My recommendation is have them start a walking program, a very easy walking program. Have them put a goal. Generally, 25 minutes should be I wouldn't say a realistic goal, but 25 minutes should be good, should be ideal. But if they can't reach 25 minutes of walking, that's okay. So get a baseline of where they're at. For example, some people can just take 2 steps. Some people can do 1 minute of walking, or 3 steps, 4 steps, 5 steps, 10 steps. The bottom line of this is that have a baseline, have them walk, and then when they get tired, they tell you, I'm tired, I can't go on anymore. Write that down. That is their baseline. So for some people, it's simply just getting up from a chair and they're already tired, and that is their baseline. Have them do a little bit more than their baseline every day. For example, they can only stand up for 10 seconds, then have them do 20 seconds the next week, 30 seconds the following, and so on and so forth. If they can walk, that's very good. If they did 5 steps this week, then the next week have them do 10 steps. Even if they're just taking 1 step further each day, that's still a win. If they only do 1 minute of an improvement each week, that's still a win. Every second, every step is a win. It's really important to motivate these people, these patients, and not to dissuade them. It's already hard as it is for them. It's not uncommon for these people to have memory issues because they don't have enough oxygen in their brain, so they can be forgetful. Be aware of this And then the second thing that you guys could do as well is incorporate some type of strength training, any kind of standing exercise that you guys could think of. Generally, I have patients go up on their tippy toes or heel raises, marches in place, or mini squats. Stick to 2 or 3 and write that down on a whiteboard where they could really see and emphasize it for them. Remember that walking is good, but it's also really important to get a strength training program for them. There's 2 brackets to this. There's walking and there's strength training. If they can walk 6 days a week or have some type of cardiovascular endurance exercise, that's really good. Walking is different from strength training. So if they can strength train at least 3 times a week and have a walking program of 6 days a week, that would be really, really good for them. Get a routine going. I normally tell my patients to walk, to do their exercises an hour or 2 after they eat because they have calories and they have energy in their system. So, for example, if they have breakfast at 9, wait maybe 10 or 11, and then have them do their exercises. That way, they have calories in their system. And especially for those who are diabetic, you don't want them to exercise when their blood sugar is already low because they can be hypoglycemic. Get a routine going, have them walk or have them do some type of strength training. Then you can rest for a little bit, and then lunchtime comes, rest, nap, and then maybe 2 hours after, have them walk again. It's really important to get these patients moving because laying down is the worst thing that you can do for your body because your lungs are not working as much and they're at risk of getting pneumonia. And 1 day of bed rest is equivalent to 4 days of strength loss. I repeat, 1 day of bed rest is equivalent to 4 days of strength loss. It's like you're in outer space, and that's the last thing you want to do for your heart. Have these patients sit up, or have your loved ones sit up, get a chair, have them sit up. That it's better than laying down. So there's 3 buckets to manage this. The medicine. The second thing, how to manage CHF or heart failure, or congestive heart failure, is food. Generally, you want to keep them on a low sodium diet. I am not your doctor, so make sure you speak to their primary care provider and how much sodium these patients can take. Let me look it up of how many grams of sodium you can do. It's generally you can do 1,500 to 2,000 milligrams per day of sodium. So really read the labels. Make sure that you're reading can labels, restaurant food. It's really bad for them, for you. Make sure it's low salt, and for diabetic patients, low sugar. Diabetic diet, cardiac diet. Salt retains water, and that's how you gain the weight. And the third is exercise. So again, guys, usually there's 3 things how to manage this. You have 3 buckets to this. Number one, you have medications, you have diet, and then you have exercise. I repeat, you have medications, diuretic, blood pressure medications, and 2 is food. You want to keep it low sodium, low salt, low sugar, because sugar can also affect your blood vessels in your heart. And the third is exercise, because you really want these people and patients to get them moving. And the research states that people who exercise improve their quality of life, not only because they can walk more, it improves their mood because exercise releases endorphins. That is arguably better than any antidepressant. And there are studies even saying that exercise can be better, I'm not saying it is, than drugs to lower your A1C. To recap everything of how exercise can help and how it can help with patients with congestive heart failure. Congestive heart failure or heart failure means that your heart is not pumping enough blood throughout your body. Imagine if it's a heart, it's called cardiac output in scientific terms. Your cardiac output is limited. There's 2 types of heart failure. There's systolic and then there's diastolic. Systolic means that your left ventricle, your heart, guys, is like, there's 4 chambers. Think of it like a circle. Well, your heart is not shaped like a circle, but just think of it like a circle, and there's a cross. There's the upper chambers here, left and right, and there's lower chambers. Usually the chamber that's really pumping blood throughout your body is the lower left. So it's lower left, sorry, lower left. That's called your left ventricle. And if that is not working as much, the fluid backs up. If it's on the left side of your heart, usually your lungs get congested. If it's on the right side, your legs get swollen up. And the other type of heart failure is called diastolic heart failure. That simply means that your heart has thickened. It could be from aging, it could be from obesity, it could be from diabetes, it could be from hypertension or high blood pressure. With diastolic heart failure, it doesn't happen as much, but just for your FYI information, think of your heart like a bowl. You don't have enough fluid inside your heart because the bowl is very thick. So if this is a bowl and it's super thick, then there's less fluid in your heart, which means it doesn't fill as much. So there's not enough blood that can be distributed throughout your body. So that's why these people who have diastolic heart failure, they're okay sitting down. They feel good. They don't get short of breath when they're resting. But as soon as you start walking, their heart can keep up with the load and they get out of breath. And it's really depressing. I've treated numerous patients who have heart failure, and it's really, really depressing. And you do what you can, but it really affects you mentally, because imagine just not being able to move and you get out of breath. It's not that they don't want to exercise, but there's also the mental component to it that you can't move as much because you're always out of breath. And I've heard people say they're hard-headed or tigas ng ulo. I refrain from those words because they they want to move, but it's just really traumatic for them because they can get out of breath and they don't have enough oxygen in their brain and they can collapse. So make sure that these people you measure, you always to get into the nuance for those people who have nurses, doctors in their family, make sure that you measure their blood pressure, their vitals every day, and make sure weigh themselves every single day as well, because if they gain too much weight, I think it's about 2 to 3 pounds in one day, then that means that they're gaining too much weight. That could be a medical emergency. You have to call 911 or wherever in the Philippines. I think when I was a kid, it's called Amity 161. So a sudden weight gain of greater than 3 pounds in one day, call 911. If there's sudden weight gain of greater than 3 pounds in one day or greater than 5 pounds in 3 days, you have to call. These are just numbers. But if it's accompanied by symptoms such as shortness of breath, nausea, dizziness, when in doubt, bring them to the hospital. And if there's chest pain, they feel like they have palpitations in their chest, then make sure that you bring your loved one to the hospital right away so they can be treated in the hospital. Just a simple blanket overview of congestive heart failure, which is very devastating, especially to Filipinos, our culture, because we love amazing food. Good food, man. Jollibee, lechon. I'm sorry, but I love those food, and I'm very guilty of that. Be careful, guys, especially with restaurant food. When I was out with my grandma, she would literally tell the waiters and waitresses, "Dai palihog, dutay-dutaya lang ang asin," or in translated to English, put a little bit salt, because she really took care of her diet. And if you have a loved one who have congestive heart failure, make sure there is a primary care provider following their case, because you really want these people to be followed. If they need their meds need adjusted, pick someone that communicates with you efficiently and have a good relationship with their family doctor or their primary care provider. And you want someone that's competent, have a good relationship with them, because these patients will need doctors for a long time. So make sure you pick someone that you have good relationship with and that's communicative and that can adjust their meds quickly. All right, y'all. What's up, Chris? Kamusta kas? I miss you. What up, what up? John Oliver Lim, Pogi. Thank you. Thank you so much. Salamat sa inyo suporta. Rejan, classmate, kamusta part? Feel free to comment below, youtube.com/Dr. Kyle, DoctorKyle, and I can fix a lot of things, but I cannot fix a broken heart.